You are listening to a recording from the 2021 PM&R Scholars Virtual Residency Fair. We would like to take a moment to thank the residency programs who have taken the time to present at our fair this year. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap, the best resource for your physiatry clinical preparation, audition rotations, board preparation, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and even oral board cases. Head to pmnrrecap.com to learn more.
I'll get started. My name is Dr. Susan Belcher. I'm the program director at the UCF West Florida HCA PM&R program in Pensacola. We are happy to welcome our inaugural class this year. We have a robust curriculum that's dedicated to inpatient rehab, advanced procedures, and resident wellness. We have a robust curriculum that includes one of the largest areas, inpatient centers. We also work with the largest pain management practice in the nation in Clearway Pain. I'm an interventional pain management physician by trade. And we also have a great pediatrics program, which include rotations, pediatric orthopedics, pediatric rheumatology, pediatric sports medicine, as well as pediatric cardiology. We also practice on the beautiful Emerald Coast. We have been named one of the best beaches in Florida. So I like to say, just imagine yourself studying for a anatomy lecture, sitting on the beach, listening to the beautiful sound. So we feel like we have the best thing here in Florida. And so I'll turn it over to Dr. Gill to tell you a little bit more about our program.
All right, thank you, Dr. Belcher. So just to get started, it's a mouthful, but UCF, West Florida Hospital, HCA, PM&R program. So we're affiliated with University of Central Florida underneath HCA Healthcare. And then the specific hospital, we do most of our rotations at our West Florida Hospital. Not going to read directly off this slide, but in June of 2021, so just this past summer, HCA started 2 new residency programs, one in obstetrics gynecology and one in physical medicine and rehabilitation. And it's an exciting time for the hospital and everyone around. Actually, this coming summer, there's going to be new residencies in emergency medicine, general surgery, internal medicine, and psychiatry. So a lot of new colleagues to work with in the future. Very exciting time for the hospital. And then in terms of HCA, this isn't their first rodeo. They've been a part of a lot of residency programs and fellowship programs. And so in terms of training here and being at a new program, you are well positioned for immediate success here. Again, not HCA's first rodeo, and they've trained a lot of good doctors. So, and then in terms of West Florida Hospital itself, so it's an advanced primary stroke center. And as a lot of you guys might know, stroke is one of the most common reasons patients need, acute rehab in the hospital. West Florida Hospital is very robust in terms of being a primary stroke center, and it's also CARF accredited. So it's a CARF accredited rehabilitation facility. This slide, just wanted to just give you guys a view of the hospital. Kind of looks like a hotel at the front. I always thought it looked really nice. So it's a really nice looking hospital. You'll really enjoy just being in the area. Like Dr. Belcher was saying, it's weather's great, people are great, the facilities are great. But I did want to kind of focus in here on the number of inpatient rehab beds and then the overall amount of hospital beds. So you have about 60 inpatient rehab beds and about 400 total beds. So you can kind of see with the ratio how much of the focus at West Florida Hospital is on inpatient rehabilitation. So whether you're on the inpatient rehab floors or you're on an off service, something like neurology, the focus around rehabilitation on any rotation is really there at this hospital. And kind of going over the rotations, Dr. Belcher went over a few of these, but I did want to key in on these inpatient rehab blocks. So the way we split it up right now is having 6 blocks your PGY 2-year, 3 blocks PGY 3-year, and 3 blocks PGY 4-year, giving you 12 total blocks. Some programs do this differently. You know, there's not a right way to do this or a wrong way to do this, but the focus here at our program was to get some exposure to outpatient rotations during your PGY 2-year. And then as a PGY 3 and a PGY 4, you'll have an opportunity to have a senior role where you end up helping with consults, but you also have more of an opportunity to teach residents underneath you, which will give you a better opportunity to learn what it's going to honestly be like as an attending, because before we know it, we'll graduate and have that big responsibility. So we'd like kind of splitting it off that way. And then in terms of some of the other rotations, inpatient neurology, fantastic rotation. I actually just came off of that. You learn really good neurological physical exams, which will carry over to inpatient rehab. Honestly, it carries over to every rotation. That's what you'll kind of see in rehab curriculums is all this stuff. I know, I remember med school where it sometimes feels like you're learning so much and sometimes the overlap's not there, but you'll see a lot of overlap in residency in some of these rotations, neurology, MSK, all those skills you learn, all of it will add to each other and will just make you better physicians. So a couple blocks of neuro, MSK. So I just got off of that with Dr. Belcher, who's a superstar and I think is double fellowship trained in peripheral joint and spine and in pain medicine. So if you guys have any interest in pain medicine, sports, spine, or procedures, Dr. Belcher is the best. So that's a very exciting rotation. And then as Dr. Belcher also mentioned, we have quite a variety of pediatric rotations, rheumatology, orthopedics, sports medicine, that's over in PGY 3-year. I don't want to read directly off slides for you guys. So that kind of covers a lot of it. Again, inpatient rehab, not having too much of that in any given year. So you get a chance of balance with outpatient and inpatient. Going into PGY 4-year, you have some blocks for electives. So that's where you can kind of tailor your curriculum to specific areas and avenues you want to go into. Over here on the right, I just kind of wanted to go down the different specialties PM&R physicians often go into and to kind of tell you guys how the curriculum is good for you guys if you are interested in those specific fields. So, if you end up wanting to go out of residency and start practice right away and be an attending, you get plenty of inpatient rehab. And that'll be across the board at any program, to be honest. You'll get plenty of inpatient rehab training. There's no shortage of that. If TBI is another fellowship people can go into, you will see a lot of TBI in those 12 months on the general rehab floors. Same with spinal cord injury. We have one of our attending physicians, Dr. Slobodian, who is trained in spinal cord injury over at Stanford. And so actually just saw a spinal cord injury, today on my first day of inpatient. So you get plenty of opportunity with that. Sports, again, we have a ped sports rotation. There's a lot of overlap with the MSK rotations. And I don't know if you guys are familiar with Dr. Andrews. He's a famous orthopedic surgeon who works with a lot of professional athletes. He's actually has an institute over in Gulf Breeze, which is really close to Pensacola. So kind of sky's the limit in terms of our curriculum. Hopefully we're looking to get some faculty members, maybe even from there, who can, help, move this program forward and provide a lot in terms of sports medicine. Pain medicine, I already mentioned Dr. Belcher. If you guys have any interest in pain medicine, I already learned so much in a couple of weeks, so I have a lot more to learn, but in terms of pain medicine, you get a lot of You get a lot of training. We have a palliative care rotation that also is an avenue PM&R physicians can go down. Neuromuscular medicine, you get a ton of neuro training, EMG. Again, talking about the pediatrics rotations, we have 4 robust outpatient pediatric rotations. And then on top of that, again, working on getting electives in inpatient rehab, which you have 3 electives that you can do. So you can, I know that was a question in the last, for the last presentation, one of the medical students was asking about rotations outside of that. So the electives would allow for more training in pediatrics if you're interested in that. And orthotics, prosthetics, again, we're setting up by the time your guys' class, if you're applying this year, orthotics, prosthetics, sports coverage, getting all that and having that be ready for you guys, that'll all be there. So any type of training you want will be established here. I want to quickly go over the ACGME requirements. Again, at any program, really. I know that's a common medical student question, but what's funny being on this end now is I kind of see now that, programs wouldn't be ACGME approved if they couldn't hit these requirements. So really at most programs, you guys will hit these requirements. Now, I did highlight some of these procedures we have to do, injections, ultrasound. I think within 1 week of working with Dr. Belcher as a PGY2, I've already hit the ACGME requirements, which goes to show you guys just how much of an opportunity you have, to really thrive here and get your hands on and, do a lot of procedures, not just consultations and kind of the mental aspect of, physician work, but you'll actually have a lot of chances to do hands-on work. That requires a lot of repetition. So even though I've kind of hit these ACGME requirements, I can promise you guys, I am not like a superstar in doing this yet. And as Dr. Belcher knows, we all have a lot more training to do. So I just want to reassure you guys that if you are interested in applying here, you would have no shortage of procedures. Some facts about Pensacola, if you guys are familiar with the Blue Angels, they're really renowned. They're like a US Navy flight crew. They're around here. A lot of sunny days. A lot of, if you guys like, laying out in the sand on the beach, there's like 3-4 beaches close by here. Really nice people. You can live close to the hospital. Not a high cost of living in the area. So a lot of good things in terms of Pensacola. And kind of mentioned this, again, we're spoiled in terms of the beaches. Like if I get bored with Pensacola Beach, I can go to Navarre Beach or Perdido Key Beach. So there's a lot to do in terms of that. Good food around here. I actually haven't been to this Naval Aviation Museum yet, but people have told me it's really a great place to see. So there's plenty to do here. In terms of living here, I wanted to kind of highlight this. So I thought I was clever. I thought I was going to live like the closest to the hospital. I'm here down to the bottom right. I'm like 6-7 minutes away from the hospital, but 2 of our other residents are more clever than me, and they're just 3 or 4 minutes away. They could probably even walk there. So if you guys want to live close, you can live close, be right by the hospital. One of our other residents actually lives downtown, and that's still 15 minutes away, and he lives downtown, which is sometimes can be more exciting for people, and you can live close to the water too and still get to the hospital. So, and as I mentioned, cost of living here is not too bad. I'm paying about somewhere between $850 $900 for a one bedroom apartment, and I'm kind of keeping that to myself. So if finances are tighter, you can live with a roommate, a co-resident, and then be under $500 a month. So I know cost of living coming out of medical school can be a concern. So there's plenty of opportunity in terms of living here. Here's, we have some fun here too. It's not all work and clinics. So here's 3 of the residents. So that's me on the left, Sean, and Sean, two of the other residents on the right. We went over to Destin. We were on this banana boat ride. It was a ton of fun. We did a lot there. But again, in terms of doing fun things, if you get bored with Pensacola Beach, which is just about 10 minutes away, you can take an hour trip east and you can hit 3 or 4 different beaches. Fort Walton Beach, here's Destin. There's actually another one, pretty famous one called Panama City Beach. So plenty to do around here. No shortage of fun. Here's a picture of us all looking fancier and cooler than we are. But I just wanted to kind of show this to you guys to show you how excited the hospital is, not only for our class, but just for the future classes to come on board. Yeah, this was the first day they had a press conference for us, which was really surprising. One of our, so there's actually 3 OBGYN residents at the hospital right now who are all on the right of this picture. And then there's 4 of us PM&R residents. Sean, he actually wasn't in this picture because he was such a good PGY1 resident. And his program wanted to keep him around to do a few more IM shifts. So we were thinking of just cutting and pasting him in the picture, but really, guys, if you want to apply here or considering applying here, everyone is very excited. Like just kind of the aura around the hospital, everyone's excited to teach. Sometimes I've been in rooms and an attendings like Dr. Belcher or some of the other attendees at work, they'll spend 10, 15 minutes. They'll take time out of their busy schedule to keep teaching, which truly means a lot. And everyone's really excited about the residents here. And here's some pictures of us. Over here on the left and the right is us, doing some Botox injections. And over here in the middle, so over here on the left, we've got Dr. Montgomery, who is anesthesiology trained, but she also works at the Pain and Surgery Center. So she's pain management trained. And then we've got Stephen, one of our residents on the left. That's me in the middle, Sean, and then over on the right, our rock star program director, Dr. Belcher. So great program. Here's some more information on our program, a website that can be linked to, prospective resident benefits. I can say, salary here is good. It's in like the mid 50s, 50,000, and no state income tax. So we do have an Instagram. So if you guys are on there, please feel free to give us a like and follow us. And here's some contact information for us. So it's my first and last name with a period in between at hcahealthcare.com, and then our program coordinator, Cody Curtis at hcahealthcare.com. And so if none of those other slides convinced you to apply here, I can say we have the most amazing program coordinator. She really goes out of her way to help us in so many things, made this transition to residency so smooth. So she's the best. I can't say enough. She actually helped me with this PowerPoint. So I made it and then she made it look 10 times better. So really we have a great program coordinator too. It's a full team effort here. So I did have a couple notes here that I didn't put in the PowerPoint. I think I started remembering some of the things I would ask as a medical student too, and I just wanted to answer some of those questions too before kind of making you guys have to, type all these questions. Hopefully I can answer some questions for you. So on the inpatient rehab side, you do have internists who are on the floor who can be consulted to help with medical management, which is very, very helpful because it allows the residents to focus on the rehabilitation aspect and kind of bounce things off of internists who are solely focused on the rehab floor. So they're actually not coming in from the it's not like they're taking care of 12 people at the hospital and then you're consulting them and they have to rush over. They're solely dedicated on the rehab floor. There's also pharmacists on the floors too, so you can kind of bounce things off them if you have any questions about medication interactions or anything you're ordering. Didactics, we currently actually have it split into 2 days, about a couple hours each. On one of the days, we do a more kind of formal lecture setting. On the second day, we do more hands-on work. Currently, we're working on a lot of physical exam skills, yeah, that's how our didactic curriculum is split up. We're an advanced program with 4 spots. So it's advanced, so you would link like a PGY1 spot when you're applying here, which, you know, at first I thought I would want to go to a categorical program because you can kind of stay in the same spot for 4 years, which has its benefits, right? You don't have to move. But I will say it really worked out having the intern year at a separate location. I'm from Michigan area, so I was actually able to stay close to friends and family before moving in the middle of the pandemic. And then having kind of 2 programs and having that unique experience in the first year and then coming to an advanced program had a lot of benefits and was very exciting. So that's our program. And so it's an advanced position. We are building a simulation center, and I think that'll be on kind of running in about a year. So you'll get a ton of opportunity to practice in a kind of a more lower stakes environment and get a lot of practice in. You get parking near the hospital, food stipend. They actually give you a work phone. So I got like an iPhone 10 for free. We get, again, a new program. Everyone's so excited. They bought us scrubs, board review books, equipment, anything we need. We kind of just talk about it, you know, try not to abuse it, but just, again, everyone's so excited to just support us and help our education. So I can't say enough about that. So with that, hopefully I didn't ramble too much. If Dr. Belcher, I don't know if you have anything else to add or anything I missed, but questions if Dr. Belcher doesn't have anything to add.
No, I think that was a great job. I've been trying to answer some of the questions on the Zoom chat, and so hopefully I'll cover those.
All right. Let's see. I'm trying to jump back and see the chat.
Yes, if the audience members has any questions, for the last minute before we wrap up this session. And please feel free also to record all the program emails and contact information in case you have any questions, and you can later on check out the Virtual Residency Fair's database in case you weren't able to record them for later.
Let's see.
I think Dr. Belcher, you answered all the questions in the chat box. So yeah, I don't see any questions coming in. Would you like to add anything before we wrap up this session?
Let's see. I'm trying to see the chat. I'm like getting. Oh, I see the chat. Okay. All right, I see some questions coming in. Let's see. Thank you. Oh, let's see if I get these in orders. Are there residents with families, kids? So out of the rehab residents, no one with families. I know the OBGYN residents, a couple of them are married, and in terms of having support for that, again, I can't say it enough. Everyone here, and I think if you're applying in the current class, think actually me and the 3 other co-residents right now would be actually the senior residents by that point. And so any support you need in terms of helping out or in terms of your education or kind of balancing family and kids with residency, again, everyone here is really incredible, great culture around here. So can't say we have a resident who has that, who has a family of kids, but it would be a no issue here. Let's see. Yeah, let's see. Oh, Dr. Belcher, I think you were answering a bunch of these questions. Thanks for, let's see.
Yeah, I'm sorry not to cut you off, but I guess that's all we have for time.
Okay, perfect. And again, you guys can, you can email me with any questions. No such thing as dumb questions or anything like that. I remember being in your guys' shoes. So please ask away to me or Cody. We would love to answer your questions.